A new report from the American Cancer Society shows an overall drop in U.S. cancer deaths. It also highlights a startling uptick in the number of young women being diagnosed with the disease. According to the report, the cancer mortality rate in the U.S. fell 34% from 1991 through 2022, averting roughly 4.5 million deaths. However, in 2021, women under the age of 50 were 82% more likely to develop cancer than men in the same age group. That marks a 51% increase from cancer rates among young women in 2002. Researchers say breast and thyroid cancers account for nearly half of the diagnoses in this group. Dr. Larry Norton joins us now. He's a breast medical oncologist at the Memorial Sloan Kettering Cancer Center. Dr. Norton, thank you for your time. Why are we seeing this increase among young women?
Well, we can't say we know for sure. I mean, we do know that there are a number of risk factors for breast cancer. Obesity is the number one thing that we can control for. And obviously, when you're seeing a change, it's not because of things like family history and genetics, which we know underlie a lot of breast cancer incidence. It's got to be something that's changing in lifestyle or in the environment. And so we know that obesity is a very, very big problem. But there are really other factors as well. The age at which somebody gives birth is a factor. Whether people breastfeed, breastfeeding is good, not breastfeeding actually increases risk. Dietary issues are a very big problem, we know, in the United States. There's a lot of processed foods, a lot of processed meats. High meat diet, and we know increases the incidence of cancer in a very real way. And now there's more discussion about what's a safe level of alcohol, if there's a safe level of alcohol. We thought that moderate drinking was not harmful, but it may be, and that's being investigated now. So whoever is drinking alcohol, whatever you're drinking, you should be drinking less is probably a very good idea. There are other things that we don't know about. People feel that sleep disorders may increase risk of breast cancer. That's still being studied. We do know that exercise is very important, and we do know that most Americans don't exercise enough. They don't get enough steps in during the day, and they don't do adequate aerobic and muscle building exercise, and that's a big factor. And we also have to look at estrogens, especially with younger women. What are they doing in terms of birth control, for example? Is there a change in the patterns of the kinds of birth control people are using in that regard? What influence that is having? So there are a lot of unanswered questions, but there are things that people can do right now to lower their risks. And the number one thing you can do is to avoid obesity.
The report noted that cancer death rates among Black and Native American patients are 2 to 3 times higher than white patients. Why is that?
Well, again, it's probably multifactorial. We do have a huge problem in this country in terms of healthcare equity, a huge problem in terms of getting the advances that we've made in breast cancer and all cancer diagnosis, screening, and management to all Americans. And that is a significant factor. But there may be other factors as well. People who trace their ancestry to Africa have a higher incidence of triple negative breast cancer, which is a more serious form of breast cancer that we see. And that may change the mortality rates, for example. So access to care is a very, very important issue. Access to screening so we can diagnose things earlier when they're more curable. But there may be other factors as well that are biological and are being studied very actively now by many of us so that we can do specific interventions and decrease the incidence and the likelihood of death of cancer in these target populations. It's not just Black Americans, Native Americans, Pacific Islanders. We're seeing changes in Asian Americans as well. So there really are a lot of questions that we have to ask now and study very intensively.
Yeah, lots more to study, Doctor. We appreciate your comprehensive answers. Thank you for your time.
Thank you very much for having me.